So before we begin to look at the various care functions, we need to know how to pick up and hold the children we'll be caring for in our various facilities. You may be wondering, why are we considering this? Now, a lot of harm has been done to children and even to the caregiver due to improper handling of children at the center. So it is important that we consider this aspect. And that's why we're doing this, how to pick up and hold infants and toddlers. Now, when children are in your care, it is expected that at one point in time you need to hold them, either to feed them, calm them when they are crying, or cuddle them when they want to sleep. So, to do this appropriately, you need to speak with the parents. This is a mistake many caregivers do. As as a caregiver, you need to speak with parents. As Ask the parents about their preferences, ask how their children like to be picked up or held up at home. This will make the transition process pleasant for both parties. I always get this feedback from caregivers that a child admitted into their facility months ago still cries every day uncontrollably and all that. And I tell them that's because you're not making the child feel at home in your facility. Now, it might sound harsh, but that's the truth. What makes a successful caregiver is when a child feels at home with you, even when no one from home is present. Okay, so have you noticed some kids smile and wave at the mom after dropping the child off at the facility? And the child will be waving at the mom, bye. And the child, little baby waving, because the child can no longer tell the difference, okay, between the facility and the home. You can imagine that. Okay, that's a level of achievement, okay, and you can also achieve that level of relationship with the children in your care if you take time to get to ask the right questions from their parents upon enrollment. Okay, you need to communicate with the parents. Don't just admit a child and then start caring for that child. No. Talk to the parent, communicate with them, write down their responses in your personal journal. I hope you have a personal journal as a caregiver. Do you? Do you have a personal? I'm not talking of communication book now or communication channel, the software you're using, communicating with parents. Your personal journal. Okay, do you have it where you document things about the children that's personal to you, children you're caring for, or things that the parents might have told you, or things you've discovered about the child that is helping you to manage the child much more differently? I'm sure you have that. If you don't, you need to begin to work with a personal journal. You make references to them and see how to handle a child. Observe them. It helps you to know the child, know what is wrong, what is not right, what has changed, and all that. So, with this information, you will know which method works well for every child, and you will know how they want to be carried, signs they make when they want to sleep, and how they want to feed, and all that. You need to speak to the parents, write their responses down. Don't just accept the child, okay, and start caring for that child. The child will never be comfortable, and you also will also have a very hard time managing that child. So this is very important. Now, how do you hold infants and toddlers? In the first few years, infants have limited ability to control their movements and to transport themselves around on their own. So caregivers have to help them move around the environment as needed and to help them develop their sensory motor skills and all that in order for them to be able to learn how to maneuver themselves around the environment. So caregivers need to support an infant's body as as well as possible, so that you support them, their body fully as you carry them. So for infants, there are several ways you hold them. So these are the common holds for infants: the cradle hold, the shoulder hold, the belly hold, the lap hold. So these are the various holds. Now we're going to be discussing them briefly. Now for the cradle hold is the hold in which adults sit or stand with the infants cradled and all that. So there are different. We're going to discuss them in detail. So I'm going to use a brief picture to explain them. So before I do that, I just want to just give a brief overview. So we're going to be looking at them: the cradle hold, the shoulder hold, the belly hold, the lap hold. So we're going to be looking at them one after the other. So let's go now and start with the cradle hold. So let's talk about the cradle hold. This is a hold in which the adult sits or stands with the infant cradled against their chest in one arm, while the other arm adds support to the legs or the bottom of the child. So the cradle hold is one of the the best positions for mothers. Is actually a hold used for feeding an infant. That's why it's the most common breastfeeding position for mothers. It is also useful for soothing a baby and also allows you to establish eye contact with the baby. So that's what a cradle hold is, as you can see here. Now the shoulder hold. The shoulder hold is the hold in which the infants lean up on an adult's shoulder while the caregiver wraps one arm around the infant's bottom and use the other arm to hold against his back or support his neck. Now, the shoulder hold is used when walking with a baby or trying to calm a baby down. Babies who is trying to sleep, they sleep well in this position. It allows them to hear your heartbeat and your breath as well. So this is the hold for that, as you can see here. That's what a shoulder hold is. Now, the belly hold. The belly hold is like the reverse of the cradle hold, where the baby lies on your arm at a slight upward angle facing the ground. So this position is actually useful if you're trying to bob a gassy baby. So that's what you use it for. If you want to bob a gassy baby, as you can see here. So that's how it is. Like that's what you use this hold for the belly hold. So it's good you understand these different holds and see how to use them when you're carrying an infant and all that. The lap hold. Lap hold is actually for downtime when you want to look at the baby's face, sit upright in a chair and probably place the baby on your lap and their head towards your knees and facing up. So baby will lie on your arm with your hand supporting the head and the neck. So that's how this is. And these are basically used for infants, actually. For infants, toddlers will not stay calm when you're doing this for them. You already know. So it's good you understand so that you don't work yourself up or injure yourself when you're trying to use what won't work for an infant, what won't work for an infant for an infant, or what won't work for a toddler. So you don't use something that is for infants and begin to try to force it to use on toddlers. You get frustrated, it won't work, you might injure yourself or injure the child. So that's how it is. So it's important for you to understand all these things, to know how to use them and how to apply them. Now, for toddlers, the best way to pick up and hold a toddler is through the upright carry. This you do by bending your knees and pick up the toddler under both arms and lift up. Then you put one arm under the toddler's bottom and support his or her back with your other arm. So even though the toddlers are full of energy, always running around the whole place, there are times when you might need to pick them up and carry them when they are tired or probably they are in a safe spot and you need to quickly save them from that. They are probably in an unsafe spot now. You're trying to save them from that danger. So, but sometimes most caregivers get injured at this point. Why? Because they are trying to pick up the toddler in the wrong way and they might fall down, break their backbone, some develop waist pain and all that. This will eventually affect your job. It will affect your job performance, your efficiency, and then you might begin to lose interest in saving the child. And that's why you see some caregivers, they will just sit down and a toddler is running to danger. They'll just be screaming. They'll be calling their name. John, John, how can a toddler hear you? Immediately you call John, John, you give the child an energy to move around more. They'll get running and they will start, yes, I'm noticed by my caregiver. They will start jumping everywhere without knowing that you are calling them to leave that particular place. They don't get you. They will find it funny. They'll find it exciting that you've given them an attention. They will keep doing what they're doing or run off again, come back, run off and begin to play with you. All they know is play. So you need to stand up, you need to go to work, you need to go carry them and pick them up. So that's why you're having this injury. So if you have all the right proper training, even though it is your job to protect the child, you will know that yes, I'm protecting the child, but I also need to protect myself as well. So you will need to pay attention to your own health and safety as well. So you won't totally ignore the child, but you will do it in a much more safer way that will also be helpful to you. So this involves learning how to appropriately pick up and hold the children, the infant and toddler. So now let's use this image as a guide to help us learn how to pick up toddlers. Now squat in front of the toddler and place your arms around the toddler and lift her towards you. Then you use the muscles in your legs to stand up and lift them off the ground. But make sure to keep your back straight and hold the toddler close to your body as you're standing up. And when you finally stand up, hold them in front of your body with their weight resting on your chest and arms. So you keep your arms around their back and under their backside. After successfully holding them this way, you can now proceed to do whatever you want to do. Probably you want to change their diaper, feed them, change their location, or you want to move them away from danger. You can go ahead. But the focus here is how to pick up and hold them rightly without causing injury to the child and to yourself. So this is very important. So now that we've seen how to pick up a toddler, let's see how not to pick up a toddler and infant. Okay, for infants, know that whatever position you choose for holding them, always support their head. So that's just it. Do not carry an infant without supporting their head. It's very dangerous. They are still very fragile at that point. So always make sure that you're supporting their head. Never pick up an infant with an unclean hand. What this means is that whenever you want to pick up an infant, always wash your hands. This is because as infants, their immune system is still developing and your unclean hands can pass on the infections to them. So it is important for you to always keep your hands clean. And that's why facilities that don't maintain hygiene, and all that, you see the children always having infections, always getting sick and all that. These are the little things that they fail to adhere to that is causing all those things. Sometimes you might begin to ask yourself, why is this child falling sick? What have you done wrong? These are the little things that causes it. So the parents that knows, that understand these things would easily know that something is wrong somewhere. So you have to pay attention to all these things and make sure that you are not the cause of making the facility lose a parent. So it is important for you to always keep your hands clean, even if you can't reach out to maybe the hand washing water at a particular time. You should have a hand sanitizer handy all the time. Never lift up or grab a child by the arms. This can lead to a pulled elbow and a dislocation which causes severe pain around the elbow. This is always common in a childcare facility, always common. Okay, though sometimes this may not be intentional. As I mentioned earlier, the caregiver may be trying to prevent the child from falling or getting injured, so they quickly try to lift the child, but unfortunately that lift may end up causing a serious harm than good. When you pull a child by the hand, this can put a stress on the elbows, and there's a danger of a ligament slipping out of place and get caught between two bones of the elbow joint. Have you heard about nursemaid's elbow? Now, this incident is what is referred to as nursemaid's elbow. This happens a lot of times, and you see the children crying uncontrollably, especially when no one could figure out the cause of the cry. You might not hear anything, you might not know, but it has happened, and you see the child crying. But a toddler may show some signs of pain, though, when they are a little advanced by holding up the arm in pain. So it will easily help you to know that, oh, this is what has happened, then you quickly help the child. But most times, no signs to tell, so it becomes a challenge. Even with the slightest pull, this can happen. So it is important to avoid pulling a child up totally. Do not swing a toddler around by holding onto his arms and arms. Avoid any form of pull that may sprain the child's arms. Avoid swinging a toddler. So these are basically it. No swinging, no tickling, no rolling, and all that. No flinging, trying to show the child up, bring the child down, all these things just to see. Probably you just want the child to smile and laugh. Don't do that to your child. It's dangerous. So now that we've learned about how to successfully pick and hold a child, it's time to begin the care function proper. So we're going to be starting with feeding. So let's get to work.